We are now with the famous Dr. Jim Harris from Colorado. He is one of the pioneers in FUE technique. He had many devices he invented and helped to create the robot that do actually the hair restoration. Dr. Harris, being one of the pioneers and doing the hair restoration for such a long time and having such a great reputation, what do you think will be the new perspectives for the robotic surgery?
Well, I think one of the things we're working on is actually the implantation of grafts. Now, that's one of the most time-consuming, technician-independent or dependent parts of the procedure. So if we can automate that, we're hoping to create a system where the technicians have a role in the surgery, but not the repetitive type that they've been playing. So I think that's number one. The second is there's always room for improvement, and there's a constant drive to improve the dissection protocols for the robot.
Okay, very nice. But do you think the robot is in the state-of-the-art development, or do you think it will keep going and getting more advances?
It will always keep getting more advances. There's a lot of room to improve the algorithms that do the dissection, how closely the robot follows each graft, each dissection. Also, donor area management is really important, and I think that's one of the next areas that we need to concentrate on.
Excellent. So do you think we are in the time that the robot can do like the Jetsons, the robot can do it by itself, so you don't need to do anything, or you still need a surgeon to do the procedure?
That's a really great question, Arthur. I think there's always room for the surgeon, and I think it's a tool. Just like a handheld device, the robot is a tool that we can use, but it always has to be up to us how we want to treat our patients.
Yeah, the surgeon's always the soul behind the procedure because he makes the design and everything. Jim, you were asked to do the robotic study, to start with that, because your great results doing your system, the special dissected for FUE that preserve. I saw you doing the surgery with your device yesterday. Excellent results. Congratulations. Beautiful. So my question is, you got your own device and you develop also the robot. What do you prefer to use in your day-by-day?
That's another great question, Arthur. I use both. And it breaks down to a couple factors. One of them is the patient. In other words, some patients have seen the results that I've received with the robot, and they know that's what they want. There's also a little bit of a difference between the grafts that are produced by the robot versus the type we produce by hand. And I think that gives the quality and consistency that I'm looking for. But there's always patients that I've operated on before that I've done by hand. They're 100% pleased with the results, so that's what they want. They want the human touch.
Definitely. But even the placing, you told me about the placing. I know that you got the hair studio that you can develop the design. But my concern about that is that we need the human touch, because for extracting the follicular unit, I think it's perfect, the robot, because you need to be perfectly aligned. You need to be centered in the follicular unit to calculate the depth, to be all perfect. So it's very mathematic. So a robotic system that comes from the military field, that's perfect. But to create art, maybe something different, the hairline. What do you think about that?
We're working on the process. I think that hair transplantation, there is some art to what we're trying to do, but it's also you and I trying to recreate nature. And nature has certain patterns. And I think there's certain computer algorithms that can mimic nature to a great degree. But I think there's always room for the human touch. One of the advantages that the robot gives us, like you mentioned, the precision that it gives us for the extractions, it also gives us precision for making sites in between existing hairs. And, you know, after 3,000 grafts, maybe we're not as precise, whereas the robot's precise every time. So I think there's some room for the robot as well.
So the time for Leonardo da Vinci is over?
No, we're still important. I don't think there's ever going to be a time that we're not needed.
Okay, thank you very much. So we've been here with Jim Harris from Denver. Thank you very much.